Good afternoon. My name is Jacobus Schutte. I am the Minister or Secretary of Finance for the case study 2, and I will presenting on how I will manage my part of the the case study with the in regards of the pandemic and how a finance minister will handle will what I would need to do in this situation. First off, I'm just going to start with introduction and some background on the case, and then I will stepwise go through what I would do and how I would handle it, and end with a quick conclusion. So, on December 31st, 2019, China reported a cluster of pneumonia cases linked to the Hunan seafood wholesale market in Wuhan, marking the onset of the COVID-19 pandemic. Fast forward to April 24, 2023, and over 2.7 million cases have been reported globally, necessitating a robust financial response. As the Minister Secretary of Finance in our health system, my role is crucial in orchestrating effective budgetary responses. This case study outlines strategic steps and considerations for navigating the financial challenges posed by the pandemic. It involves a dynamic approach, balancing immediate fiscal needs with long-term resilience and adapting to the evolving nature of the crisis. Beyond number crunching, my role demands strategic foresight, collaboration with health experts, and optimal resource utilization. The following sections will delve into detailed steps and considerations guiding our health system's financial reaction to the ongoing COVID-19 pandemic. First, I would start to allocate financial resources. But before I can do this, I need to assess the current financial status of the health system and identify the available resources. I will do this by working closely with the Ministry of Health to understand the immediate and long-term financial needs related to COVID-19 response. I will allocate funds for purchasing medical supplies, equipment, and medication. We'll consider increasing budgetary provisions for testing, treatment, and research. Next, emergency funding and budget reallocation would also need to happen. You can do this by collaborating with relevant authorities to secure emergency funding for the health system to respond effectively to the pandemic. Consider reallocating budgets from non-essential areas to prioritize the COVID-19 response. This may involve reprioritizing existing projects or programs to redirect funds to the critical needs. Support for the healthcare facilities will also be needed. Can do this to ensure that healthcare facilities have the necessary financial support to enhance their capacity, including expanding ICU beds, acquiring ventilators, and hiring additional staff. I would also facilitate the procurement of personal protective equipment for healthcare workers, ensuring a continuous and sufficient supply. Funds would also need to be made available for research and development funding. I would allocate funds for research and development activities related to COVID-19, including vaccine development, therapeutic research, and epidemiological studies. I would also encourage collaboration between the research institutions, the pharmaceutical companies, and the public health agencies to expedite this process. For the general public, an economic stimulus and social support will be needed. You can do this by working together with other governmental departments to develop economic stimulus packages to support businesses and individuals affected by the pandemic. I would also consider financial assistance programs for those who lose their jobs or experience economic hardship due to the lockdown and the restrictions. You would also need to work internationally with all the other countries to come up with a solution for the problem. You can do this by engaging with international organizations and donor agencies to secure financial aid and support for health system responses. We also collaborate with my neighboring countries and global health entities to share resources and expertise. For this all to work, we would all need to be transparent and be held accountable for our actions and make sure that there's no corruption. We can do this by maintaining transparency in financial decision making related to the COVID-19 response and establish an accountability mechanism to track the utilization of funds and ensure they are directed towards effective and efficient interventions. Also, we would need to plan for long-term financial needs of the country, and you will do this by developing a strategy for the long-term financial sustainability of the health system, considering the potential for future waves of the pandemic and other health emergencies. In conclusion, a coordinated and well-funded response is imperative to effectively manage the impact of the COVID-19 pandemic on public health and the economy. Collaboration with health professionals, policymakers, and international partners is crucial. By leveraging collective expertise and resources, we can implement cohesive strategies transcending geographical boundaries. This collaborative effort is essential not only for addressing immediate challenges, but also for building resilience against future health emergencies. As the Minister's Secretary of Finance, I emphasize the importance for aligning financial decisions with public health priorities, ensuring jurisdiction, resource allocation, and fostering a symbiotic, unified for fostering a symbiotic relationship between the economic stability and healthcare resilience. This unified approach is key to navigating the current crisis and preparing for future global health challenges.